Active surveillance is a safe and increasingly common way of managing prostate cancer, which is unlikely to progress for some time or may never progress in a man's lifetime at all. Active surveillance is still treatment, but treatment is given if or when it's needed.
There's a lot of research which shows that for some men diagnosed with prostate cancer, they may never require any treatment. This is because either the cancer doesn't progress at all, or if it is growing, it's at such a slow rate that it will not cause any symptoms or affect their quality of life.
Initially, a lot of people thought, well, active surveillance means doing nothing, and I want the best possible treatment available to me. Careful monitoring through active surveillance for low-grade prostate cancer cases can be as effective as a radical option like surgery, and we know that from the recent trials. So active surveillance is a valid form of, quotes, treatment, and I think we need to reassure men that they are being looked after and there will be intervention at the right time.
To men who've had a cancer diagnosis and a cancer diagnosis which is low grade, I would tell them that active surveillance is not a risk and a positive decision to keep an eye on the tumour and very closely monitor it rather than treat it. For a man with a low-grade disease, it is often a much better decision for them to go for active surveillance of the disease rather than radical treatment straight off.
If prostate cancer is suspected, a special type of MRI scan can be used to visualise the prostate gland and may help identify potentially cancerous areas. Samples or biopsies from these potentially cancerous areas can then be taken, and taking biopsies in this way can in turn improve the accuracy of diagnosing prostate cancer. The biopsies which are obtained are analysed in the laboratory to give a grade of prostate cancer, and this is called the Gleason score. Today, the Gleason score is measured on a scale from 3 to 5. The cells in Gleason grade 3 are very similar to normal healthy cells. The cells in grade 5 are very abnormal looking. The most common type of cancer cells are allocated a score between 3 and 5. This is then repeated for the second most common type of cancer cells, giving 2 scores which are then added together to give a final score out of 10. To make the potential risk of the prostate cancer progressing easier to understand, the scores are placed in groups according to their potential risk, with 1 being very low risk and 5 being high risk. Men in group 1 are typically given the option of active surveillance, although this can also be an option for some men in group 2. Once the results of the biopsies and MRI scan have been analysed, they will be reviewed by a group of specialists at a multidisciplinary team meeting or MDT. These meetings will involve urologists, oncologists, histopathologists and radiologists, as well as specialist nurses. They will discuss and review all the available results and suggest potential treatment options based on current clinical practice and national and international guidelines.
For men on the active surveillance programme, typically they can expect to visit the outpatient clinic every 3 months initially with a PSA blood test, every 6 months for a physical examination of the prostate, just to ensure there are no obvious physical changes. Further MRI scans and biopsies can be repeated at intervals. If any of these investigations show the cancer is progressing, there are still curative options available. Active surveillance aims to reduce over-treatment, but means men can still be cured even if treatment is delayed.
After getting over the initial shock of being diagnosed with prostate cancer, I was a bit uneasy on any course of treatment really. I thought that going on active surveillance would give me an opportunity that I might not need treatment. There again, if I did need treatment, at the time I needed treatment, then perhaps there were new procedures I could take advantage of, which would probably have, or possibly have, lesser effects, like lesser after effects. My surveillance started in 2012, I think it was, after my initial 2011 diagnosis. I was having 3 monthly blood tests, and after that I was having biopsies every 12 months or 18 months. My wife would attend with me regularly, and that also gave her reassurance about my condition, and and what could be done, and you know, the hope at the end of it, if my condition did worsen, there were opportunities for me to have a choice of different treatments. I had the MRI scan on the prostate, showed some shadows that we're not happy about. So following that, I was referred to my, my consultant. He suggested that I have another biopsy, another template biopsy, just to confirm what the shadows were. My Gleason score had moved from 6 to 7, that was 3+4, and my PSA had moved up to 6.1. It was basically time for me to go for more radical treatment. I elected to have the prostatectomy, and that went very well. That was by robotic surgery. I haven't looked back from that. I've made a very good recovery.
We know that regular exercise following treatment for prostate cancer is beneficial and can help with side effects. Although there is still no definitive evidence to suggest it can slow down the progression of prostate cancer in men with early disease who haven't had a treatment, it is felt that a combination of a healthy diet and regular exercise may have an effect on increasing a man's lifespan. This exercise doesn't need to be performed in a gym or running marathons. Activities such as brisk walking, gardening, sports and resistance exercise are all good ways of strengthening the body's immune system, which helps the body to cope with everyday life. Although there is no definitive evidence to show that any particular diet can prevent prostate cancer or reduce prostate cancer that is already present, there is ongoing research looking at the potential beneficial effects that a healthy, varied diet with, for instance, less reliance on red meat, eating more fruit and vegetables, fish and natural produce may have on slowing cancer progression.
You know, prostate cancer suffers of being a man-only disease, and as a man-only disease, we find a lot of men don't want to talk about these things and don't want to admit the problems they've got, and again, don't know who to talk to. Yes, there are men that like to take control of the situation and Google something every day, and there are men that don't want to know anything about it, and it's that group of men who bury their head in the sand, if you like, that we need to help. And my view is that a support network is crucial to helping these men open up and talk about the situations.
At my initial consultation when I was diagnosed, one of the pieces of information I was given was relating to my local support group, Phase. I wasn't the sort of person who would think about joining support groups initially, but given the diagnosis of cancer and how I was feeling at the time, I thought, well, I'll give it a go. It was the opportunity to meet a lot of people there who had been through similar situations as I had. There was a lot of education coming out in the presentations that were given to the group by healthcare professionals and experts in the field. And that again reassured me that I was actually doing the right thing being on active surveillance.